Father.
Morning.
Good morning, Father. Good morning, Father.
Very good morning, Father.
Father, not all this. Okay.
Hello. Just respond
Morning,
to
Father.
some issue the audio consent. Hello.
Good morning, sir.
Hello. Those at his own classroom, please respond.
Very good morning, Father.
Good morning, Father.
Morning, sir.
Good morning, Father.
Good morning, Father.
Good morning, Father. Morning, Father.
Morning, Father.
Hello. Hello.
Yes, Father. Good morning, Father.
Morning, sir.
Hello.
Hello, Father.
Good morning, sir.
Hello, Father.
Good morning, Father.
Good morning, sir.
Just set audio. There is some technical issue with the audio. We made 2 minutes.
Okay, Father.
Good morning, sir. No.
Hello.
Hello, Father.
Hello.
Good morning, sir.
Hello, Father.
Hello.
Good morning,
Yes,
sir.
Father.
Hello.
Father, good morning,
Yes,
Father.
Father. Hello. Good
Hello.
morning. Good morning,
Hello,
Father.
Father.
Hello.
Hello, Father.
Hello. Hello, Father.
Hello.
Yes, Father.
Hello, Father.
Hello.
Father,
Yes,
hello.
Father.
Hello.
Hello, Father.
Okay. Yeah, I had some issue with my settings. Okay. Now it's cool. Yeah. Good morning, good afternoon, good evening. Just type in where are you from in the YouTube comment space. Same attendance like yesterday, no improvements. That rate is just 9. We need to reach at least 30 to start the session. Sooner the better. We have less time today. We started 30 minutes late. Try to remind your contacts to join. From Tanjavur, Tamil Nadu, Chandravati, welcome.
Good morning, Father.
Good morning. Even at main platform, you can put my notice in reply mode and ask them to join. So they are at least alerted.
Okay. Okay, Father.
Yeah. It's a minute silent prayer. Good morning, good afternoon, good evening, wherever you are from. Greetings of the day. Welcome to EduSkills OET Made Easy. If you're watching this on YouTube, kindly consider subscribing to the channel. Give us a thumbs up if you like our work and share the video to your contacts so that we reach out to maximum number of OET aspirants. As of now, we are finding difficult to carry on with the batches because we have less number of participants. It's not improving in spite of awareness created. Some other we'll have to see some solutions. We have the same number of participants attending from 3 batches, only 19. And if it doesn't increase, some of the batches will be cancelled. Probably only the active members will have sessions in the Zoom. Today, we'll be looking into reading part B, reading part C, and listening as well. Some of the concerns will be addressed, the discussions which are going on, or some of the doubts being asked will be explained. At the same time, we'll look into something of listening as well. Are you ready? Just type in ready if you're ready. Chat rate is just 18. We have to reach 30 to begin. Chat rate is 18 now. Everybody has to try. Anu Sabin, thank you for your super chat. Yes. Dorothy, thank you for your super chat. Yeah. Super chat begins with 10 rupees. You can try getting one so that if we reach to maximum people, that helps our reach to other people. Yeah. Yeah, the more you chat, more you have super chats, we reach to more people. Yes, that's the easiest way. It just costs 10 rupees or so. It begins with 10 rupees. You can try anything. Okay, much more than the money amount, that crown you have with your message, that helps us to reach more people in social media. Yes, Josna Joy, thank you, Josina Joy, Dorothy Devi, yes, super chats. Yes. If I miss any name, you can send one more message and I'll see the name so that I do not scroll back. Those who have purchased super chats. Let's see, yes. Same people. See, couple of them, 3, 4 of them are messaging again and again, not others. That rate, yeah, everybody try some messages, some hearts, some emojis. Yeah. Waiting, no smiles. Yeah. Ready for the yes. Super chats, yes. Yeah. Probably we will go with all these people who want really to join the mission. Chat rate, yes. 5 more chat rates. Those who have not messaged, please, you don't lose anything by sending some messages so that I will have maximum chat rate. Yeah, see, when you chatted, when you purchase some super chats, 4 more people join. The benefit is this: when they search in the YouTube, automatically the link will reach, they will immediately see the link and join. Yes. 5 people have joined this. So let's hit. Yeah, you can also keep something about EduSkills, something about OET, track or your OET with super tips. Yes. Super tips, God bless you, Father, and the admin panel. Thank you. Marvish, yes. Thank you. Yes. That's great. So super chat are posting repeatedly. Others are not posting. Yes. Yeah. Yeah. By the meantime, if you have some concerns at Zoom Classroom, you can ask me now. In 1 minute, we will be beginning. As we reach the chat rate, yeah, we are waiting for 2, 3 more chat rates. Yeah. Yes. Keep chatting in between. Keep sending some emojis, some energy, some smileys, all those, even during the sessions, that will help us to reach people. Yeah, going up. See, now you see the difference. Now it was just 19. Now it is 29. With this chats, just posting your chats, you could help out reaching so many people, 9 people more. Yes, Ranjit Mohan, thank you for the super chat. Yes, you know, super chat, there is a dollar icon at the bottom. You can click on it and purchase a super chat for 10 rupees. That helps us reach our mission, focus on the model verb and scale in the question and in text. Jackson, Mini Jackson. Thank you, admin Mini Jackson. He has been posting from the very minute that I posted the link in the YouTube channel, Dorothy, Mini Jackson, such people. Jessina Joy, that's good. Yeah, Amanpreet Kaur, after so much time, I'm seeing your one messages. And Dua, I never saw your message. I think you are too stingy or
Father.
conscious. I didn't see any of your message there in the YouTube comment space. Samjata Amang, thank you for the super chat, Samjata. Thank you so much. It's much more than amount it reaches. You see now it's almost 31 people. From 19 it has gone to 31. If you simply try just posting messages repeatedly, that helps reach. You know, chat gone high. Yeah, great. Let it go a little more, 1 more minute. Yeah, everybody simultaneously. Yes, type in something, some positivity. Yes, some energy. That also will refresh your mind to concentrate. I didn't see any message from Yogesh. No message at all. Yes. I think Yogesh is not connected to YouTube.
No, Father, I'm there. I think due to
Hello?
network issue, my voice was not. Am I
Sorry?
audible, Father?
Yeah, yeah.
Hello.
Are you connected to YouTube?
Hello. I was trying to speak. Your
Yeah,
voice,
yeah.
when I open my mic, it is not audible.
No, are you connected to YouTube? I'm asking. I didn't see any of your message over there.
Hello.
Can you hear
Am I
me?
audible?
Can you hear me? Then just respond at YouTube comment space. Can you hear me? Hello? Hello? Yes. I think you can attend via YouTube because you are supposed to be connected to YouTube, right? Yes. In spite of repeating so many times, the participants don't even listen to. Yes. Yeah. I'm waiting for Anu Sabin's message in YouTube comment space. Yeah, thank you. Thank you. No, yes, Jayabiola, thank you. Christina, thank you. I'll help you. Please share the link. Yeah, Ranjini Mohan. Please, she says, please share the link to your contacts. Yes. See, if they don't connect to YouTube, we'll send them there. Then sometimes we admit here, thinking that they will listen to us, but they don't. Silent, thank me later. Okay. Marvis. Okay. Right. Okay, let's begin. Let's begin. We'll rock with reading, listening. As I said, these are all same strategies. No much difference. Only listen, read, understand. Let me know if you can see my screen at YouTube comment space. Okay. Can you see my screen at YouTube? Yes, Father. Thank you. Thank you. So we will begin with a sec. Okay. OET 2.4, reading part C. We will begin with reading part C, then we'll go to OET reading part C, concern. See, the concern is this. Hi, Father, good morning. I couldn't understand how the answer to question 12 is option B. That is, she says infection control. Could you please explain it to me? I think option A is correct. The person who sent me this, I think it must be Deepika or somebody. Okay, let's check. Okay. Now the person says A is the answer, but there is a confusion with B. We'll have to find out which is the answer. So what is highlighted as an important component of patient management? Come on, what are the hedging words, keywords?
Highlighted.
Highlighted, okay.
Patient
Fast and
management.
loud,
Patient
Patient
management.
management.
an
Important.
important component
Important
is
component.
very important, right? Of patient management. Okay, right. Option A, the use of corticosteroids.
Corticosteroids.
Infection control, there is nothing to highlight as such. Early
Early
intervention.
intervention.
And C, option C, excision of scar tissue. Okay, there is nothing hedging words here. Can somebody read this? Let's see how it works. Anyone fast? Don't give too much time, waste time.
There is no cure for asbestosis. Treatment focus on a patient's ability to breathe. Medications like bronchodilators, aspirin, and antibiotics are often prescribed, and such treatment as oxygen therapy and postural drainage may be recommended. If symptoms are so severe that medications don't work, surgery may be recommended to remove scar tissue. Patients with asbestosis, like others with chronic lung disease, are at a higher risk of serious infections that take advantage of diseased or scarred lung tissue. So, prevention and rapid treatment is vital. Flu and pneumococcal vaccinations are a part of routine care for these patients. Patients with progressive disease may be given corticosteroids and cyclophosphamide with limited improvement.
Okay, now any idea? I don't know the origin of this material somebody has sent to me. EduSkills always respects the copyrights. Anyone?
For the topic sentence, there is no cure for asbestosis. So supportive care is
Supportive care is? Okay, come on. Oh, supportive care is?
important. So
Okay.
and the-
What could be the answer then? There is no cure. That is the topic sentence. There is no cure at all. Can you eliminate any option with that option? With reading this sentence? Any option?
early
Early
intervention.
intervention.
Yeah, early intervention
Early
can be
intervention.
eliminated, right? Because there is no cure at all. Then why do you intervene? Where do you intervene? Okay, now the
If the
person has a
symptoms
doubt
are
whether B or A is
Sir,
the answer.
if
like
symptoms are so
bronchodilators,
strong
aspirin,
that
and
medications
antibiotics
don't work,
are
sir.
Medications don't work.
So if the symptoms are so severe, so the option A is eliminated. Use of corticosteroids.
Medications don't work. So you mean option A can be eliminated. Others can object. Okay, no problem. Yes. Now, there are two now. Excision of
The prevention and the rapid.
yeah,
Further.
yeah. Where is it?
So the prevention and rapid treatment is vital. So infection control. I don't know.
Prevention and rapid
Rapid
treatment
treatment.
is vital. Any others? So she says B could be the answer. Anyone else? You can say something. The other person says A is the answer. Yeah.
Last
What is
sentence also said for the corticosteroids and the cyclophosphamide with the limited improvement. So A is also eliminated.
Okay. Now they are asking what is highlighted, means illustrated as an important component of patient management. Here, if you have idea of may be recommended, what is it?
Surgery.
Maybe. Maybe means we can think of the model verb. How does it work? May be recommended to remove scar tissue. Which option?
Option D.
Option D. It is not highlighted. Maybe. Is it highlighted? Recommended, highlighted, illustrated, emphasized? No, maybe. Medicines don't work. Surgery may be recommended to remove the scar tissue. May be recommended, not highlighted. Maybe. You may do it. But I am not recommending it, illustrating it, or highlighting it. Any other? Again, you see may be given. Which one?
Corticosteroids.
Steroids. I'm just trying to make you understand why this may be. What is the importance of modal verb? And what is the meaning? Okay. So this is maybe. Which one? Fourth one is
D.
maybe. This is maybe. So it's not highlighted, illustrated. Then the use of corticosteroids is maybe. Okay. Early intervention is not given, or there is no cure for asbestosis. So that is eliminated. Now, where is the real answer?
Patient with asbestosis, like others with chronic lung disease, are at a higher risk of serious infections. So, infection control.
Okay, now you see, patients with asbestosis, like others with chronic lung disease, is not required for us. What comes in between comma? So you can read like this: patients with asbestosis are at a higher risk of serious infections. So prevention and rapid treatment is vital. Is it the language like maybe?
No, Father.
The patients with asbestosis are at a higher risk. Are factual statement, emphatically stated. Serious infections. Okay. So prevention and rapid treatment is vital. So prevention of infection is, control of infection is vital.
Important.
Vital is opposite of may, right? Okay.
Okay, Father.
Correct?
Yes, Father.
Yeah. So that is the answer. The thing is this, I don't know where do you get these materials. Actually, you go to all the 5 sample materials, you don't find such challenging materials or such materials without evident strategies. But still, for you to understand, so I'll show you here. See here, the use of corticosteroids versus may be given. Okay, and infection control, early intervention, there is no cure, and it's not given also. But then we can presume the excision of scarred tissue. Excision means surgery. Surgery may be recommended, but they are asking what is highlighted as an important component. Very important. Other things maybe you can do this. You see the tone of the language? Maybe you can sleep. but I suggest you to think. Okay, thinking is vital to understand OET. But then maybe you can sleep, or maybe you can enjoy your life. Maybe you can do side business. And I tell you, if you are not loving OET, if you don't concentrate on OET, and when you attend sessions, if you do other business unnecessarily, that shows that attitude is a clear sign of you will not crack OET easily. Okay, that's from our experience. So another concern somebody has sent is from reading part B. I couldn't understand why the option is C. Please explain to me, Father. The person is saying, I don't know why C is the answer. Okay. The results of the study described in the memo may explain why. Hedging words. Smile
The
and
result
shout.
of the study.
Results of the study. So you should look for a study described in the memo may explain. May explain why. Why means they are asking for a reason. Yes. They are asking for a reason. You have to look for a reason. So, option A, superior communication skills may protect women from dementia.
Superior
communication.
Yeah. Okay, option B, female dementia sufferers have better verbal skills.
Better verbal skills.
Okay, they can be good orators. They can be giving speeches, sermons.
Yes, sir.
Options.
Females, yes.
Option C,
Good verbal skills.
mild dementia in women can remain undiagnosed.
Remain undiagnosed.
Okay. Somebody please read. Let's see which is the answer. Come on.
Women's superior verbal skills could work against them when it comes to recognizing Alzheimer's disease. A new study looked at more than 1,300 men and women divided into three groups. One group comprised patients with amnestic mild cognitive impairment. The second group included patients with Alzheimer's dementia, and the final group included healthy controls. The researchers measured glucose metabolic rates with PET scans. Participants were then given immediate and delayed verbal recall test. Women with either no mild or moderate problems.
Now you see one thing I want to tell you before you continue reading. Now they are asking for the result of the study, right?
Yes, Father.
Now a new study is introduced here. Then what they are saying is about their study, who participated, what was done, all those things. So gradually you have to come to that competence where you simply ignore that portion, because result will be at the end.
Yes.
They explain who participated, what was done to them, how they responded, all those things. Then the results will be given. So results will be at the end. So to defeat the time, if there are two paragraphs like this, you can skip to the next paragraph and see whether a friend is there. Now,
Okay.
mild dementia. Here there is mild, right? So a hint is there. Okay, more. Yeah, come on, read.
Women with either no mild or moderate problems performed better than men on the verbal memory test. There was no difference in those with advanced Alzheimer's. Because verbal memory scores are used for diagnosing Alzheimer's, some women may be further along in the disease before they are diagnosed. This suggests the need to have an increased index of suspicion when evaluating women with memory problems.
Okay. Any idea which is the answer?
Some women may be further along in their disease before they are diagnosed.
Which means some women will already have mild dementia even before they are diagnosed. Because you are looking at the communication of the women, and they are good at speaking, right? So it's not easy to recognize. Is it because of dementia, or is it out of joy they are speaking too much today, these days? Because maybe they got a good result, they might speak more on those days. They're happy. So why? Because is there, right? Question says the results of the study described in the memo may explain why. When you say results of the study, you have to look for a study. Then if they are explaining about the study, you can ignore that area. Not now. Later on, you have to practice that way to defeat time. Then you go to this one. Now because is there. There will be something due to, because some word will be there which explains the reason. Some women may be further along in their disease before they are diagnosed. Means they were undiagnosed. Mild dementia in women can remain undiagnosed. Any doubt?
No, Father.
Yeah, this is only the paraphrasing of this. That's why I said paraphrasing, you should practice paraphrasing, write down. Superior communication skills may protect women from dementia. Here they are saying women's superior skills could work against them. Could work against them means?
Doesn't work.
Does it protect? May protect women and
No.
work against them. Are they same?
No. It's
They're
opposite.
opposites, right?
Opposite.
Yeah. So superior verbal skills doesn't help them protect women. That works against them because they keep on speaking. Since you have superior verbal skills, it's very hard to diagnose dementia in you because you'll be keeping on speaking. People think you remember everything. Okay. And female dementia sufferers have better verbal skills. Does it say anything of that? Nowhere else
So,
verbal skills are mentioned,
Verbal
right?
memory test, yes, sir. Not skills.
Yeah.
They're talking about
tests are,
verbal
yeah.
memory test, yeah.
Tests are different, not skills. Tests are not skills, right?
skills. Yes. sir.
Tests are tools. Skills are verbal skills are skills. Other one is tool of testing the verbal skill. Is that clear?
Yes,
sir.
Father.
So Y
Yes,
C is the
Father.
answer. Let's try one more. So you see, because answer is here. May protect women. As I said, it is not may protect, it works against women. Female dementia sufferers have better verbal skills. Here it is may. In the question is may. Here it is have, means it's a factual statement. Cool. Let's try one more with why. Why did the scientists decide to examine blood from these people? Fast.
Why?
Why?
Yeah, you should have some energy. You should shout louder. Okay. Then only you will love OET. Yeah, you should show some energy. Why? Why? Come on. Super chat chapter is
Scientists.
just two. Scientists decide to examine blood from these people. Why did the scientists decide to examine blood?
Examine blood.
Okay. Option A, because is there in all the four? Because the majority of AIDS cases are in these countries.
Majority.
Majority of AIDS cases.
Majority of AIDS cases. Okay.
AIDS cases, yeah.
Okay. Option B, because these people are making AIDS neutralizing antibodies. See, these countries, you should understand these concepts. These people, okay, examine blood tests from these people, okay, because they have large amounts of virus after at least 3 years of infection. They have
large
amounts of
virus.
They can be these people. Okay. Because their bodies contain enzymes that glow when the virus enters a cell. Contains enzymes. Okay. Now this is about, because the majority of AIDS cases are in these countries. Can you test the blood of countries? Can you test the blood of India? What is the group?
No.
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 So if the concept is different, immediately we can eliminate, right?
Yes.
Yeah, because they are asking about that blood test of these people and they are speaking about these countries. So eliminate. Yeah. Now we have these people, because they have large amounts, these people, they may be, because their bodies contain enzymes. Yeah, come on, read the passage with a smile.
The team
Come on.
appointed.
Sorry, second instrument. Mute the second instrument, please. If somebody has a second instrument, please lower the volume. Yeah, otherwise there will be echo. Yeah, please read loud. Hello. Is somebody reading?
Yes,
The
Father.
team pinpointed those who had not exhibited HIV signs, those suffering from the virus at least 3 years, because these patients produce large amount of natural antibodies in their blood, which fight against almost all strains of HIV around the world. Dennis Button, a scientist at the Scripps
Do you
Research
need to go so long?
Institute, because the because word is there, Father.
When why is there? Because should be looked into, right?
Yeah.
I don't know whether you have answer there. Just check.
These patients produce large amount of net. It's 3, Father, option 3.
Option C, you mean? Large
C,
amounts of virus. Large amounts of
Virus.
natural antibodies. Is it same as natural antibodies and virus?
No, Father.
Huh?
No.
See, producing virus is very dangerous. Concept. Neutralizing
B.
antibodies.
Father, B.
Huh?
B is a neutralizing antibodies.
Yeah.
B, Father.
In their blood, which might fight against almost all strains of HIV, means
HIV around the
neutralizing,
world.
right?
Neutralizing.
AIDS neutralizing. AIDS neutralizing means what? Fight against
The fight against
almost all strains
all
of HIV.
All strains of HIV.
Yeah. Almost scale expression is there. If you want, you can think of these patients. Okay. You have here these patients.
Father,
And only
question
this option has option has these 4 people. Yes.
Father,
Come on.
question says these people. So the answer
Pardon?
option B is also.
Sorry, I couldn't hear.
Father,
Speak loud. Yeah, speak loud. Speak loud.
Father, question stem says these people.
Yeah.
And the answer option B is also says these people.
Yeah.
So immediately go to the option B.
And here also they are saying these people in the text. These people. These people. Yeah, you are right. These people. These people. And these people. These patients, right?
These patients.
Yeah, these patients with these people. Making. Any synonymous expression?
Produce.
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 Produce. How beautiful you see. What I'm saying, if we have that, why did the scientists decide to examine blood from these people? The team pinpointed those who had not exhibited HIV signs, those suffering from the virus for at least 3 years, because these patients produce large amounts of natural antibodies in their blood, which fight against almost all states of HIV around the world. So after, because you have the answer, right?
Yes, sir.
A scientist
Yes,
at the
sir.
Scripps Research Institute, the key player in the research team, Dennis Button. After that, you have all these compliments. We said if we want broadly neutralized, we should look for people, infected individuals who are making them. He added the key thing about the antibiotics we have found is that they are more potent than previous ones, and that's great for your vaccine. Once the blood was gathered from HIV patients, the samples were shipped back to a team with the Monogram Bioscience Laboratories in San Francisco, where researchers studied the samples to determine which antibodies lead to more resistance to the virus. Please mute. The team had developed a process that caused the enzyme embedded in the virus to glow when it entered a cell. If the researchers did not see a glow when performing the process, it was a signal the patient's natural antibodies had fought off the virus. So that's only saying about the details of the study. But the reason why is given in the beginning. Is that clear?
Yes, sir.
See, now there is somebody, they are not even listening to their own distractions, which means they are not attending the session. Please don't come to Zoom classroom. Okay? See, if they are listening, they understand
Yes,
their own
sir.
distractions are they are listening, right? That is a clear sign they are not attending the session. And that's a clear indication that you are not going to pass OET. Okay? If you don't have that attitude, it's very, very challenging for you to pass OET. I tell you. Because we are telling you repeatedly, but then you are not able to even attend that. I know you have kids around you, all those issues we know. But then at least caution should be taken, right? Otherwise, what happens, everybody, you can see comments in the comment space, shouting at you or shouting at me. Why can't you mute your participants? All those things. Some videos you can see, maybe one video of that reading party at diabetes, which has gone more than 180,000 views. You can see the full video is full of distractions. That was the initial stage when I started the sessions. Okay, right. So you can, cool. Any doubt? See, here also you should be conscious about the concepts, okay? Here it is, these countries, the concept has changed. You cannot have blood test for the countries. Here antibodies, here virus, here enzymes. See the different concepts? Here it is saying antibodies. Is that clear?
Yes, Father.
Yes, Father.
Yeah. So analyzing question is more important than reading the text. If you really understand, analyze the question, stem and the answer options, understand the concept-based hedging words and differentiating hedging words, then you need not have to spend much time on your text. Okay, cool. If you have any doubts, you can ask, no problem, okay?
Okay, Father.
Yeah. Then second portion you need not read. Shall we go to a listening one?
Yes, Father.
Yes, Father.
All these are same skills, okay? The more you are competent in reading, definitely you'll be competent. Strategically, you'll be competent to tackle listening. But the problem is only you have to develop the habit of listening, understanding the accents. That's all. But only difference is here in the reading, you read and understand and answer the questions. In listening, you listen, understand and answer the questions. But the strategies are almost same. If you want, you can take almost 1 hour, right? You can take 2 minutes break. Then we will go to listening skills. Yeah. Grab some snacks. Dua. Dua is not smiling today, not messaging today. Why is that? Yeah. No messages. Chat rate is just 13. Others can just chat. Let's go. Now you see almost 34 members are there from 19 because of your chat. From 19 it has come to 34, which means 15 more people we could reach. Only because of your chat and super chats. So chat and super chat. Those who want to purchase a super chat or get a super chat for 10 rupees, you can buy. Yeah. You need some stamina. Ranjani, get some snacks. You need some stamina for listening.
Yes, yes, Father.
Your mind should be fresh. That's why I ask you to grab something. We'll be asking after 2 minutes. Take some nuts or some juice or tea or coffee. Yeah, keep chatting. Those are free, keep chatting, okay? And some emojis. Yeah, thank you, Jomon, Sebastian. Yes. Yeah, Dua, thank you. Oh, Dua, thank you, Dua. Dua's heart have reached here. Then yes, Dua's here. Justina Jo, yes. Waka, yes. I love OET Elizabeth, yes. Thank you, thank you. Madhusri, yes. Leaves, yes. Energetic, therapeutic, medicinal leaves. Yes, Justina Jo is found. Justina Jo is found, yes. You can see the attitude. Those who have the
Good
super chat,
morning, Father.
they chat very often. Yes, please. Good morning.
Father, someone messaging me personally, like from India, the guy, he wants to join the special batch and he wants to join your classes. He is asking me to send me the link of Zoom class now. So I said it is in the special batch. Please go there, and that's why
No,
I'm asking you.
all the details they have to ask in the main Telegram
Yeah, I
group.
said ask the father first. You need to request
Yeah,
the father, so the father will send you the link. He is
yeah.
messaging me now. I am asking where you from. He said I'm from India, Uttar Pradesh, father, UP.
Okay. Maybe some people are interested in some people. That's another thing. So they don't they ignore my numbers
Do
displayed
you want
there.
me to share your number, father? Can I share your number
Yeah,
with your permission?
anybody can share my number because it's in the public platform. You can share anytime.
Okay.
Yeah, no problem. Elizabeth, thank you for the super chat. Yes. Thank you, Elizabeth. Yes. And you can share the details, my phone number, all those things
Okay,
anytime.
okay,
No
father.
issue, no
Yeah,
issues.
he said I wants to join the classes now for OET. I
Yeah,
want to practice. Please, yeah.
yeah, sure.
I will. I will message him, sir.
Yes. Power failed. I hope it will come back soon. Yes. Yeah, sometimes there are some spammers and all those exact question papers, as soon as they appear in the main platform, please post a spam message below it, okay? Many are doing it. You can also keep somewhere in the pseudo folder, in your saved folder, one message, which you can copy and paste there with all the skeletons and danger signals, because new beginners, they don't understand. Recently, somebody paid 4.5 lakhs and crying to me. We can't help it. You want exact question papers. No, you don't want to develop your skills. Okay, there are so many being cheated by spammers. So never ever look for shortcuts. From one country, around 7,000 nurses will be deported now because they all used forged certificates to reach there. Anytime you can be exact. So never go for. Jomon Sebastian, thank you for the super chat. That's great. Thank you, Jomon. Yes, that helps us to reach more people. Yes, that's great. Yeah. Any other concerns you can ask me until all reach. Shall we
Father,
go? Yeah, please.
the same person have your number and he said, I don't have a father's number. I don't know why. And he's asking me, when is your exam? I don't know is the right
He
person
is
or
not
not.
a. Come on, ma. That tells you he is not interested in OET. He is more interested in you. Okay, so beware. Best thing is to block.
Father, I don't know, yeah, where he get the number, but
No. Like usually, that's why we don't use much WhatsApp. In the Telegram, you can hide your numbers, right? There's a lot of privacy settings. But WhatsApp, people, yeah.
that's why maybe father he took the number from the
Yeah, that's
Telegram.
he must be
I don't
smart.
know how to hide the number. I will check today. I have
You
off.
can
I will
block it.
check
You
it
can
also.
just click on that number and go below. Click on that name and go below. You will find block.
All right,
Yeah,
father.
most of these people will be spammers.
Okay.
Or you can ask them, do you want to pay my exam fee? No, you're so much concerned about your exams, right? When you are writing. Yeah, chat rate 22. You can have 8 more chat rates. 22. Yes, 22. Little more chats. Those who are not chatters. Just keep something, copy and paste. Just some messages. And as soon as the link is posted, as soon as you see, just go and post, okay, so that we can reach more people. Maybe we will give you 1 or 2 days gap to reach people, and then we will finalize whatever the people we have. Maybe we'll go with only Zoom. Then work becomes easier for me, connecting YouTube Live and all. It's all. You have to get ready with the thumbnails, and it takes time. A lot of things to be done. Yes. Great. Yeah. Can I have Zoom link? Somebody is asking. I have posted several times there. Zoom link. Zoom link, yes. Yeah, Anita, you can send this. Yes. Send me here. Yeah, I'm posting the link. Please link. Yes. Somebody is asking for Zoom link. I have posted in the. Thank you, Anita. Yes. And I'm sharing the screen. I cannot copy Zoom link. Yes. Yes, I'm posting it in the YouTube live stream comment space. Okay. Let's go to listening. Are you ready?
Yes, Father.
Yeah. Now just listen, okay? No introductions. We have done yesterday introductions, day before yesterday, I believe. Okay. Just listen and try to identify which is the answer, okay? Are you ready at YouTube? Just tell me yes. After your snacks with a lot of energy. Yes. Come on. Yes, Father. One S has come. One S has come. Yes, please watch till the end. You will gain skills to pass your OET. Yes. Marvis. Thank you, Marvis. Michelle. Yes, hope I am pronouncing it correct. Yes. Give me 2 minutes because I am just admitting people. Motorola Edge, you'll have to unmute and tell me who you are because you are using an instrument name. Motorola Edge, could you unmute your video? All supposed to unmute your videos when you are here. Mr. C, Regina, Motorola Edge, Tiku Shetri, Amanpreet Kaur, she repeated non-compliance to the instructions will disqualify you from attending sessions. Are you listening to me, Regina? Yes. Motorola Edge. Yeah, some have gone out. Mr. C, are you listening to me? You have to unmute your video. Okay. Yes. Right. So listen, okay, I have no power here. Hope you can see me, right?
Yes, Father.
Yes,
Okay.
Father, please.
Yes. Before the power fails, my backup fails, let's listen. Can you hear me? The voice, audio?
Yes,
Yes,
Father.
Father.
Yes, Father.
No, not my voice. Audio?
No, Father.
No, Father.
One more time I am playing.
not yet. No.
No. Okay. Then I have to reshare. One sec. Share sound is. Yes, now will be fine. Let me know if you can, not me, if you can hear the audio, listening audio.
And you must have come across examples of.
Okay, thank you.
Father.
Yes, Father.
Yes,
Yes.
okay, thank you. Listen, okay?
And you must have come across examples of this phantom limb syndrome in your own patients who have missing limbs.
Oh, yes, of course. Many patients report feeling as if the missing limb is still attached to their body, even years after the amputation. Some patients have reported actually trying to use it just as they did before. And in the case of other patients, they feel as though the missing limb is permanently at an abnormal angle, and they have to make allowances for it when moving around. I've come across a number of instances of that. And other patients experience what we call telescoping. The sensation that the limb is still there is normal, but it's become smaller, shrunk somehow.
Okay, can you hear me?
Yes, Father.
Yes, Father.
Yeah, give me one sec. Yes. Now, what are the hedging words in the question stem?
Some
Patients
patients.
fail.
Yeah, some patients
Some
is very
patients.
important. As I said, that tells you there will be many reactions. Like the other day you saw David's reaction, many other patients' reaction, someone else's reaction. Some patients tells there are many reactions coming in here. And feel, how do they feel? Okay? Their feelings. Different feelings will be there. Dua will have a feeling, Anita will have a feeling, Ranjini will have another feeling, but they are asking some patients feel that their missing limb is still attached, but they feel it is still attached, but something happened. It would cause pain if they used it. They feel it will already, what is that syndrome they called it?
Phantom.
Phantom?
Phantom limb pain.
Phantom
Phantom
limb.
syndrome. Phantom syndrome. Limb syndrome. Phantom
Limb
Limb
pain.
syndrome. If you don't know, since we are from the psychology field, we know. See, some people, one patient has lost her little finger in the accident. Okay, it is amputated, completely amputated. Now she is complaining that it is itching. There's terrible itching in that little finger, left little finger, which she lost in the accident. Imagine what can be done. It is terrible itching, I tell you. She can't do anything. How can she itch? Any idea? You may have psychiatric trainings, psychiatric nursing trainings. What we suggest, ask them to go to the mirror and itch the right finger. This is there already, and that will help them. Okay, so that is called phantom limb syndrome. So here some patients feel that their missing limb is still attached. Though it is amputated, they feel it is attached, but would cause pain if they used it. They feel that it will cause pain if they use it. Option B is fixed in a strange position. Option C has increased in size. First option is cause pain. Second,
Strange position.
Same position.
strange position. In a strange position, limb in a strange position. Increased in size.
Increased in size. B, further option.
B is an answer, Father.
B is the answer.
It's fixed in a strange position.
Okay, listen one more time. See the nuances of the language and how they structure different people. How do they feel? If you can write down at least some different feelings, just write down. Okay, different feelings, just short form, whatever you can scribble. That helps your multitasking, listening, reading, and writing together. Yes.
And you must have come across examples of this phantom limb syndrome in your own patients who have missing limbs.
Oh, yes, of course. Many patients report feeling as if the missing limb is still attached to their body, even years after the amputation. Some patients have reported actually trying to use it just as they did before. And in the case of other patients, they feel as though the missing limb is permanently at an abnormal angle, and they have to make allowances for it when moving around. I've come across a number of instances of that. And other patients experience what we call telescoping. The sensation that the limb is still there is normal, but it's become smaller, shrunk somehow.
Okay. How many responses are there? Feelings of how many category of people? How many?
Many.
Three. Listen to it, okay? Listen to it again. C option says increased in size, but on one option says the opposite.
Last they say it's
Smaller in size.
Smaller.
Okay. Option A, cause pain if they used it. That is not mentioned.
Not mentioned.
They say they want to, yeah. Then let's see. One more time. It's a listening practice, okay? Just do the analytical thing. It's not that you go into many practices, but you have to understand the structure and the way they speak. All those things you have to understand, accents as well.
And you must have come across examples of this phantom limb syndrome in your own patients who have missing limbs.
Oh, yes.
Now listen to the topic sentence, okay? By that lady.
Yes, of course. Many patients report feeling as if the missing limb is still attached to their body.
That is a topic sentence. Many patients feel that the missing limb is still attached to their body. That is given in the question stem. Missing stem, this one. Missing their feel that their missing limb is attached to the body. Listen.
And you must have come across examples of this phantom limb syndrome in your own patients who have missing limbs.
Oh, yes, of course. Many patients report feeling as if the missing limb is still attached to their body, even years after the amputation. Some patients have reported actually trying to use it just as they did before.
Some patients Try
It
to
is
use
used
it
as
as
a
I did
before.
before.
And in the
Before.
case of other patients,
They
feel as though the missing limb is permanently at an abnormal angle. And
strange position, abnormal angle. See the synonym.
they have to make allowances for it when moving around. I've come across a number of instances of that. And other patients experience what we call telescoping. The sensation that the limb is still there is normal, but it's become smaller, shrunk somehow.
Smaller. So
And you must have come across examples of this.
almost these types of questions will have such expressions. 3 reactions, 3 responses, 3 feelings, whatever. 3 or 4. And they'll be asking a particular one. Now, out of those 3, only one is given here. One is opposite. The other one would cause pain if they used it. They are saying if they used it, but the audio says they use it. They feel like using it, no if. Okay, let's listen with the script. If you have gone through the 7 steps of listening practice, that is mandatory, okay? Unless you gain competency, otherwise you will have to practice long and long. If you go through those 7 steps of listening practice, definitely you will enhance your. You can read this, right? Is it visible? There's some interval music. Just mute. Just mute your audio.
Saravonya.
Okay, ready? The instrument is not muted, please. Sittu Shetty, we can't help, she is not attending. Yes. Yeah. It's bad, but we have to send people out. We can't help it, yeah, because they are not listening to us. Okay, listen now. This is called multitasking. It's very, very important. We are not used to it. It looks very simple. Multitasking is this: in listening, you have to listen to the audio, read the questions, go through the questions, then write the answer. So listening, reading, writing, 3 tasks together, multitasking. So as you listen now, try to read the script. At the same time, try to underline. If you don't have a hard copy, you can just write down some points, scribble some points in your notebook, okay? Yes. Listen.
And you must have come across examples of this phantom limb syndrome in your own patients who have missing limbs.
Oh, yes, of course. Many patients report feeling as if the missing limb is still attached to their body, even years after the amputation. Some patients have reported actually trying to use it just...
Sorry. That's my mistake. Okay. That is it. Yes. One more time, okay?
And you must have come across examples of this phantom limb syndrome in your own patients who have missing limbs.
Oh, yes, of course. Many patients report feeling as if the missing limb is still attached to their body, even years after the amputation. Some patients have reported actually trying to use it just as they did before. And in the case of other patients, they feel as though the missing limb is permanently at an abnormal angle, and they have to make allowances for it when moving around. I've come across a number of instances of that. And other patients experience what we call telescoping. The sensation that the limb is still there is normal, but it's become smaller, shrunk somehow.
Indrajit, your audio is not muted. There was distractions from your side. Okay. Now you see, topic sentence speaks about many patients. Then you have some patients response. Then you have other patients, sequential expressions, and they have to make allowance for it when moving around. A number of instances and other patients. These are the three feelings given. And our answer is here. They feel as though in a permanent abnormal angle, strange position, in a strange position, and is fixed. What is the synonym used? Permanently. Fixed means permanently fixed, permanently at an abnormal angle. Clear? Any doubt?
Yes, Father.
See now, listening for emotions, contrast word, synonymous language, sequential expression. Some patients, other patients. See how beautiful it is. Feeling, emotional word, but, cause, fixed in a stage, increased, many patients, other patients feel. See, this feel is here, right? Some patients have reported that it doesn't say feel. Some patients have reported, other patients, they feel. Some patients feel. The question stem has this word feel. And also, and other patients experience. Other patients experience. The emotion-based word is only with the right answer. So that's called listening for emotions. Feeling of patients with the whistling limb, feeling 1, feeling 2, feeling 3. Such structures should get into your brain. Here you have only feeling 3, okay? 1, feelings of patients with missing limb. Feeling 1, feeling of many patients. Feeling 2, feeling of some patients. Feeling 3, feeling of other patients. Feeling 4, feeling of other patients, okay? Now, feeling of patients with missing limb. Feeling 1, feeling of many patients. Missing limb is still attached to their body. Feeling 2, feeling of some patients, trying to use it just as they did before. Feeling 3, feeling of other patients, missing limb is permanently at an abnormal angle. Feeling 4, feeling of other patients, limb is still there as normal, but it's become smaller, shrunk. Beauty of the paragraph, sorry. Yes. How nice and sweet. Why I am making all these PPT and showing you, even if you are not able to make PPT, you have to write down these things, analyze the paragraph, understand it. Okay, here 4 feelings have come because the first one, topic sentence, I have taken as a feeling. You can consider it as a general topic sentence, then consider as 3 feelings. Problem, people are not habituated to practice analytically. Keep on practicing, practice. And I emphasize and say again, scores are not at all important. Only when you have your mock test, scores are counted. Otherwise, we are not concerned what is your score, how many marks you got. We are not bothered at all. The practice, intensity, depth of practice is important. Quality of practice is important, not quantity of practice. Even if you don't get any score, any answer right, that is cool. But if you have understood why you made a mistake and why that option was wrong, all those things are important. Anybody? Yes. If you have any doubts, you can ask me. If you have stamina, we'll go to some more. Let's check. Yeah, say something. Come on. It's a chance for you to build up your confidence. Okay. Always I repeat, if 50% competency, 50% confidence is must. When you go to the examination hall, you get frightened, you get nervous, you get stressed out. Whatever the competency you have, you are not able to write. One girl was so good, superb at writing subtest. Definitely she could get A+ grade. But she was telling me she was shivering. Her hand was shivering, so she was holding with the left hand and writing. Imagine then how much the mind cannot be held with your hand, right? Mind will be shivering. So the words will be sometimes flying. You can't read. These are the experiences shared by the aspirants. That's why we give you a chance of group discussions, and every session we ask you to speak something so you build up that confidence. Otherwise, it won't happen by itself. Majority lose their exams, even if they are competent, they lose their grades because of this nervousness, stress, all those things. And the best idea, one idea given by Gagana, the recent girl who spoke to you, is not to discuss negative things. Even if your friends, close friends, your study partner, whoever, if they speak this negative things, just drop that connection. Think only positive. If you fall in love with somebody, do you like some people to speak ill against them? No. So also, if you have fallen in love with OET, you will always want to speak positive about OET. Yes. Yeah, others can chat, and if you have anything, just share. How do you feel? If you have any challenges, most of my sessions are the challenges faced by students. Only when you send copyright materials or unauthentic materials, or when you send a material without key, we don't answer you. We don't take it up for explaining. One issue, copyright issue, that will harm the platform, and that's not proper. It's not ethical. Okay. Second thing, if you don't send me the answer key, I have to read and find out whether it is authentic material. If you have the answer key, immediately looking at the answer key, you can make out whether there is an authentic material. Recently, somebody sent me question 14 or 16 has around 18 answer options, a paragraph, right answers. So immediately I know that will never be the authentic material. So that's why we ask you to send the this one, answer key as well, even in the main platform. Otherwise, I have explained everything that people have discussed, which has come to my notice. There is some problems when you discuss. So try to discuss in the main platform. Nobody knows there who you are. Just you can respond. That builds up confidence and creates interest in learning. That will also say, oh, you are understanding better. And I tell you, you are the very few aspirants, OET aspirants, who understand the things. Others are just keep on practicing. 10 materials, 30 materials, 50 materials, 100 materials, 150 materials. Recently, I sent to a doctor around 75 materials. Then he said, I have all finished that. Then I sent 50. He said, he has all finished it. Then what is the use of finishing all those things? Still, the person is not improving. That's because you are not understanding what you are assessed about. Come on, now your chance. After that, if need be, we will go to 1 or 2 questions if you have stamina. 5 minutes for you. Anyone at Zoom, if you want to speak, only your sound will be heard because I'm in the focus mode. Or if you want to come on focus mode, I can change the focus mode and you can come on screen. Whichever is your option.
Hello, Father. Good morning.
Yes,
how are you?
I'm good.
Father, Anita here. Father, I'm doing the reading materials nowadays.
Not
I have
audible,
problem to find.
Now hold the microphone closer.
Hello, Father. Am I audible?
Yes.
Yes, Father.
Yes.
Nowadays, I'm reading. I'm doing that 40 videos that you posted in the group. So I have problem with hedging words, like how to find it. So I tried to your videos it makes me understand little things like things and the name we have to search for. But still, when I'm doing the reading, I have trouble to find out the hedging words.
I can't understand everything because not clear. But
Father,
then,
she is asking how to find the hedging words.
okay. Now, like I heard that you are watching the 40, this one episodes. That is just running into reading part A. When it comes, the episodes reach. There are still episodes coming up. I have to upload. When it comes to B, before we start part B, we will teach you how to find hedging words. Otherwise, you can go to that reading part, reading playlist, and a good number of videos I have explained about hedging words, 3 types of hedging words. That is concept-based hedging words. Now I showed you the concept in one is these countries, blood test for the countries, then one virus, one antibodies, other one was enzymes. Only 4 concepts. These countries, virus, antibodies, and enzymes. And the antibodies was the correct one. So what is the concept-based hedging word? What is the topic of each option? Okay. For example, what does it speak about? Spacer devices. What does the text speak about? Spacer devices. Then the options speak about electronic interference by mobile phones, about maybe X-ray machines, about blood tests or stethoscopes. So these are different concepts. You are worried only about spacer devices. So concept-based hedging words and differentiating hedging words. Sometimes all the concepts will be same, but there will be increase, decrease, or arrange manually or different things. Differentiating hedging words. What differentiates one option from other option? Then you have emotion-based hedging words. As you had now, what does the patient feel? Or what is a feeling, or what does the person, a writer, feels about it? Emotion-based hedging words. All you may not have. Sometimes you have concept-based and differentiating. Sometimes you have all the 3. Sometimes you have only one word each, as we saw now, only differentiating or concept-based hedging words. So that is in detail explained in many of the videos. And what you can do, others, please, when you watch one video, you find now somebody asked for hedging words, information about hedging words, except in main platform. You cannot post in main platform, but I'll advise the admins to post it. When you find something that is explaining in detail about hedging words, just post that link in the group. Batch group, we are allowed to post links. Post that link and say, this explains about this idea. One sentence, type it there. So one who is searching for it will find easily. Will you do that from today?
Father, I tried to post my concern on the main platform, but I'm not allowed to text or post anything on the main platform. I don't know why. I tried to text you many times.
Everyone is allowed, provided if you have not posted some links. If you are banned, you will not be allowed. Did you get any warning there?
Yes, Father. They are saying you are not allowed.
Did you get some warning there when you posted something?
Yes, Father.
When you get your warning, you have to send me the screenshot.
Yes,
or
Father.
to me or to the chief admin. Then only we will be able to allow you, because that is a robot banning you because you are using a
Father,
link or prohibited word.
Yes, Father. I have already texted Madam Anita, and also I think your number or someone else. I don't know, but I think it was your number.
I don't know. Maybe you'll have to remind if you, when you post me, no, because so many messages coming. You'll have to keep reminding. Just put a thumbs up something repeatedly, then I'll see it.
Okay, Father. Thank you.
Yeah, then we will cancel it, we will rectify it because it's not we, it's the automatic setting robot that works behind to protect the platform, yeah, from the spammers.
Good afternoon, Father.
Good afternoon.
My name is Chimmy. Actually, I wanted to let you know I got my results today. I
Oh,
had
great.
written my exam on 11th of April, Father.
Wow.
So I wanted to thank you for all your help that you have given to me and all the teachings that you have given. I was able to get good score in my first attempt itself.
Oh, great.
Thank you so much.
Congratulations. Congratulations. And if you have some
Thank you so
tips
much.
or some guidelines for our students, other students, you can share how to use this platform and all the things. How did you use? And maybe the experience in the examination hall, whatever. Yeah.
Yes,
Just
sure,
keep,
Father.
if you could keep the phone somewhere, it will be stable. It saves.
Yes, yes, Father.
Can you just
Uh,
put it some? Yeah, yeah.
yes, sir.
Cool, cool. Yes.
Actually, Father, initially I was very skeptical. I had sent a lot of research papers to you, and I would ask you most of the time, Father, does these kind of questions usually come? Can you please explain how to do research paper? And I also remember how you took a class for us one day on one of the research papers that I had sent you. So I was feeling so happy that you helped us solve. With that, I even gained a little bit confidence that even if there would be a research paper, I will be able to do it. But like you already mentioned prior, that there is no research paper that usually comes. By God's grace, I got anaphylaxis as my part A, reading part A question. And it was very easy. I was able to use all the techniques, skimming and scanning, everything, looking for all hedging words for B and C, all that I was able to do just by your help, Father. So I'd like to really thank you from the bottom of my heart for helping us, all of us, those people who are not able to get help from elsewhere, from other academy. You have helped us. You have given a ray of support for us. So I'd really like to appreciate you, Father, for all that you have done. And I really thank you for all the YouTube videos that you have sent. There are so many YouTube videos that we can go and watch and learn so many new techniques. Peel, all those techniques you have taught us about. So I was so happy when I was able to see the question paper, the way you made us love OET. I really felt so happy when I wrote that exam because I could, every time I was solving some paper, I could remember something you told us, what you had taught us. So I was feeling so happy with everything, Father.
Yeah, great. Congratulations. That's a great achievement. Yeah, a really great achievement. You
So
nailed
much
it.
fun.
Yeah. God bless your way forward. And anybody wants to ask anything? These are from real experience. You can ask if you want to clarify anything. First-hand information they can give you on any subtest or anything. How the exam day or anything. Yes. Anyone? Nothing. Even at YouTube comment space, you can just congratulations, congratulations. Many are inspiring, inspiring. Yes, congrats, dear. So many messages. You want to ask her anything? Or Simi, if you want to add something about exam day, how did you feel and
Yes,
what are
Father.
things you have to take to the examination hall? And were there some hinges or problems at the examination hall, listening issues or something like that? And how did you feel about speaking? Just in brief so that others will benefit. Yeah.
Yes, sure, Father. So initially, the first subpart that I started with was listening. I was quite confident with listening out of all the four modules, but the part A was okay, Father. B was also good. C first subpart was very difficult. So I was not able to think. So I was feeling scared. What will I do? My first C is getting spoiled. What if I end up with a C plus here? But then I tried to pray and I tried to remember and I tried to calm myself. So the second part I was able to do well. And by God's grace, the highest score I got was in listening. So I was thinking that it's not up to me what I did. So it's all like thanks to God. I was praying from the starting till the end. When I was leaving, also, I was putting my hands on the paper and I was praying, God, I've done whatever I can. You take control. You help me. I know you will lead me. So all that I was doing. And in reading part B, in between, I started thinking and panicking, what if I spoil it? But I tried to calm myself and I think one suggestion I would like to give everyone is not to panic, because in real life exam we start panicking and we start feeling scared and our anxiety takes over. Because of that we tend to spoil things what we might be doing well. So I'd like to let you all know, if you spoil anything, maybe one question you're not getting, just leave it for now, move on to the next, and don't keep thinking about the previous question that you didn't get. Speaking also, if you follow the criterias, if you know what you have to do, make sure you learn all the criterias in hand, like the clinical linguistic criterias for information giving, information getting. What are the things that you have to do? Maybe first talk to the patient, introduce the topic, then you have to ask them question, do you know about it? Then you have to make sure you go from known to unknown. Then you have to ask them, do you have any doubts? Is that clear? So these are things we have to keep on practicing. Only with practice we will be able to gain more confidence. Simply watching and not practicing will not help us. So I would like to recommend everyone to make it a point to at least give time for each and every module and practice it well. So also don't panic. That is one of the most important thing I will say. And practice only authentic material, especially for listening and reading, because I started practicing from whatever I was getting left and right. Because of that, I started getting more and more scared, and I used to go and ask father like, this kind of questions will it come? This kind of question will it come, father? What do you think about it? So I think you should always make it a point to practice only from authentic papers. See all the more sample papers that OET has. There are 5 sample papers. Try to solve them, and you will get an idea what kind of questions actually come for OET. Because if we keep on putting our head into those kind of papers that usually don't come, then it's going to be very difficult, and we will never fall in love with OET. So we will always feel scared, have that scared sensation, and we will not be able to perform well.
May I ask you
Yes.
one thing, dear?
Yes, yes, sure.
Where did you give the exam? Which country?
I wrote from India, Kolkata.
All right, all right. Congratulations. And
Thank you so
I
much.
just would like to ask you about the speaking. What was the topic for the speaking, if you remember,
Mm.
please?
Yes, yes. So one topic was a local clinic in which there was a patient who had come to me, who was a known case of anemia and also had some vitamin B12 deficiency. So she had to get B12 shots. So I had to encourage her, tell her about the condition, and encourage her to take the vitamin B12 injections. So letting her know what are the supplements that can be taken, all those were the points that was there for one. The second one was a community health center where uh, a, a child of one of the grandparent had come. She wanted to know how to treat her mother, who is a known case of depression. So that was the second case.
All right. Thank you so much. Thank you.
You're most
And the
welcome.
listening was easy. What about the C part of the listening? Was it okay?
Listening, the C part, first part was a little bit tricky, but the second one was good. But I would like to recommend all of you make sure you know the hedging words, underline the hedging words so that you can listen and you can know what they are talking about. If you don't underline the hedging words, you will find it very difficult to catch what they are actually trying to say. Because in part C, you have to listen and then try to find the answers. So make sure in the 90 seconds, underline all the hedging words from the question as well as the options, and you keep listening to them.
Thank you so much. Thank you.
You're most welcome.
Congratulations
Yes.
once again.
Thank you so much.
Hello, dear.
Yes, ma'am.
Hey, congratulations, dear. I'm very happy to have you here as a successful student, and thank you so much coming and giving your feedback. One question I would like to ask, like, did you read like the in the speaking? Did you just read whatever it was written in the card, or you used your own words? Like
Uh,
the complete words, or did you just read whatever written in the card?
So I would say I did not read the exact things that were there, because then it would be like I'm just reciting what is written on the paper. What I did was I would, most of the words would be from the like the scenario what is given, but there would be words of my own as well. So I put it in my own sentences, but mostly the important points, topics that I'm using will be from the cue card that is given.
Okay, dear. This one, you got two cue cards, right? So, in case you are not able to complete the complete cue card, is that happened to you, or like you completed all the cue cards in 5 minutes, like one cue card in 5 minutes?
I was able to complete the cue cards. Yes, maybe I was not in one of the cue card. I did not like end it well. I think that I did not tell them thank you for listening to me, thank you for your patience. I hope you had a speedy recovery. Those things for one of the cue cards I did not say because I did not have enough time. But apart from that, I was able to complete all the points that they had mentioned.
Thank you, dear. Appreciate it. God bless you.
Okay, sure. Thank you. I
Yeah.
hope I answered your questions.
Yeah, when I see you, Jimmy, I remember one thing. One girl who was from Assam.
Yes, Father.
She studied, got good scores, and reached UK. Then she was
Yes,
repeatedly sending me some messages and repeatedly calling me. Then one day I made it a point to attend to her. Then she was telling me, "Thank you so much, Father. You helped me a lot. All your videos I watched, and I got grades 2 A+ and 1 B, 2 Bs, and everything she explained." Then she was telling me, "Father, I could not attend your sessions because I am very poor. I could not afford the money."
Yes,
Then I said,
Father.
"It's absolutely free." She was shocked. She thought since these are good sessions, this will be highly charged. So she never attended. She was watching the YouTube videos. Then I told her, if at all I am charging, I would not have uploaded all those videos available to everybody.
Yes,
Yeah, at least that.
definitely.
The thing I want to drive home is that people are not aware there are free resources. We have everything. Now, when Chimi was like, she was a very good candidate. I remember she was following the instructions. So when she sent me some research material, I know that will never happen in the exam. But still, I thought, let me try because I will teach them some practice, language practice. So that's the way when we feel they are good at studying or they are following our directions, we feel like, okay, let's do it, at least for their satisfaction. But, when I did that, I clearly said it will never happen in the exam. But it's good to know how to understand these types of texts. So what I'm saying, see, from the very beginning, when you approach us, we understand whether you are going to crack OET or not, and we will understand from your responses. Sometimes you see, I send you messages. Other day, somebody was like bit angry with me, like I did not respond to her notice, something, or request, or something like that, or some response. Then I asked her, typically, if you could do me a favor, please count the messages I have sent you in the chat. And she said it is after the counting. Later, she messaged me saying that 356 messages. And then I asked, you just count your responses to my 356 messages. Two responses. Only two responses to 356 messages. See, when I send you a message, there is no automation. We are not commercial people. I am typing it everything. There is nothing
Yes.
automated in our platform. So when I spend so much time, at least that what I sent you, you understood, or you're doing it, or you're going to attend the session. One message, one short message will help us to plan the things, what type of
Yes.
people are coming here. Yeah. So that's also important. And anything else you want to ask anyone? These are the golden opportunities, okay, to learn from them, those who have really nailed it. I can't tell you what is a real writing experience because you are so selfish, health professionals, you don't allow me to write OET. Otherwise, I'll have to go and study nursing now to write OET. Yeah, any other thing you want to ask, you can ask her. And we have enough materials, I tell you. We don't give you too much material and we don't recommend to have too much material because that will not help you in any way. The analysis you do, the best quality experience you have, what the tasks we give is more than enough. So don't go for hunting. Even today, I saw materials being sent with copyrights. I was asking them, why do you send these materials? And you go and search these unauthentic materials, you break your head. Then you feel OET is so bad, so tough, so difficult. Then you start hating OET. It's very difficult. But real materials, that's why I've explained all the 5 sample materials on the first one. with all these strategies to show that these are the strategies which is applicable to authentic materials. And even the ebook is developed the first volume is based on 5 authentic website materials from OET website. So that's practically, that is the way they will give you the text. They cannot change. They will not change because they are assessing the strategical things. Professional judgments, then memorizing is.
Yes.
So please have the patience, have the quality practice. Now you see one listening, how long I did, how many slides, how many boxes, how many decorations, because that analytical perspective has to get into your brain. Anything else you want to ask others, please? At the YouTube comment space, if somebody has commented, please find how to find out authentic material and unauthentic material. There's a question in the YouTube comment space, how to find out the authentic material and unauthentic material. You can't find out because they are not competent. You need to be very competent to find it out. We had a lot of students and study groups who could find out which is authentic and which is non-authentic. I have given them unauthentic materials in between to see whether they can identify. They have identified it very well. One thing is, strategically it will not be right. The second thing, you need not get this confusion because at EduSkills you have more than enough materials available. Okay, that's enough. Why should you go in hunting for materials? And if you think, really you think you have followed the instructions, you need more materials, ask me, I'll give you. No problem. We don't give you in bulk because you'll start practicing one after another and get fed up with the OET. Then when you see me, you will not smile at me. Yes. Yes. When people hate OET, they hate me as well. That's the thing.
Father, even though we don't study or like or whatever OET, but you are like an angel. Whenever we see you, we happy.
You should be so. Everybody should be so. We should make people happy because we don't know how long we will survive in this world. People will keep our face smiling and happy in their brain. Yeah. Yeah. Anything else you want to add, Jimmy, about anything? What did you carry? What are the articles you carried that day, maybe for the exam?
Yes, Father. So I had received one email maybe 2 weeks prior from the center where I was writing an exam. So they had mentioned the timings for what all speaking, listening, writing, and all, what are the timings that I have to follow. So I took a printout of that because they asked in the bottom, they had mentioned to carry that printout as well. Along with that, I took my Xerox of Aadhaar card as well as my passport original document because I had registered for the OET using my passport, Father. So I took my passport, and just for safekeeping, I took few pencils, eraser, and a sharpener. But it's not necessary because there also they are providing us with pencil, erasers, and sharpeners. I just took it in case I don't panic if they don't give. So for my safety, I just took all those things and went, Father. Apart from that, they will be providing with all water, food, everything. So we don't have to take anything other than that.
Yeah, and there is nothing wrong if you feel like taking a pencil, 2B pencil or eraser, but then you will definitely get it there. But you can take it also if you feel comfortable with your own pencil. It's okay. But then those pencils will not be allowed. Only 2B pencils will be allowed.
Yes, Father.
And you will get a royal treat there. Don't worry about food and other things. Yeah. It's not like Indian setting. It will be more generous and respectful. Yes. Even the interlocutors, most of the cases, they are very respectful, cooperative, and encouraging. And EduSkills is the only platform where real interlocutor, who is still current interlocutor, teaches speaking module. There are 3 videos uploaded by the interlocutor. I don't want to say the name because that will be problematic. So, real interlocutor, she has said she is an interlocutor. She is an interlocutor in one of the centers in Kerala. And she has explained exactly what is expected of you and what you should do and all those things beautifully. Yes. And all these linguistic and other criteria we have explained, I have explained several times, and the videos are uploaded. Beautifully explained step by step what is required of you. Sometimes people don't want to understand the criteria. They just want to do the role play card. But criteria are important. You should have an idea what is the criteria. Then when you start working on the role play card, your brain will work in that line. As Jimmy correctly mentioned it is. Yeah, that's great. Any questions at YouTube? Congratulations. And thank you for tips. Yeah. Writing case note. Somebody is asking, what was the writing case note? What was writing case note? There are 2 questions.
Hello, Jimmy.
Yes, ma'am.
Dear, one more thing I would like to ask. How many materials did you follow? And would you like to share your synonyms?
Sorry,
Uh,
Anita. Sorry, Anita. You are not in track. First of all, you have to unmute your video. Secondly, getting all the bulky synonyms is not advisable at all. You know, it's not advisable. You have to collect. We have taught you how to learn from. That shows you are not at all following the guidelines. We have clearly said don't get bulky of lists. I have thousands of lists prepared by many students, but there is no use. Not only use, it will harm you by hurting those things. You have to keep a diary of synonyms and synonymous expressions. And now, Anita, your attitude is like you want to collect materials. What I am telling you repeatedly now, don't collect too many materials. Okay? That you have to understand that. Otherwise, it will simply kill you, I tell you. Materials, we have plenty. Maybe 70% of the materials are unauthentic, not authentic materials, what is available in social media. You know? So it's a not a relevant question at all. So always I stress that you keep a diary of synonyms, synonymous expression, whatever you get in your materials that you practice, that's more than enough. Because those are understood in the context. Those are understood in the context, not in separate segments. Yeah. Anything else? Now she is asking whether you can send all the synonymous, the dictionary, your diary or dictionary. We don't encourage it. We never have it even though we have plenty, we don't, because there is no meaning in reading it. This in the context. So I ask the people to write the synonyms, synonymous and the paraphrasing together, then understand what is the meaning. And in isolation, you don't understand the meaning.
Yes, Father.
Yeah. Yes. Yeah, that's it, I believe. Time for lunch for Indian people. Hello. Hello.
Yes, Father.
I'm sorry, I had a call, urgent call. Yes, so cool. Yeah. Keep going and share your knowledge, all of you, whenever you reach. And thank you so much for taking the time, sparing the time to come and motivate others. Thank you so much. It's great. Yeah, anytime you're free, come in and join us and join our mission so that we help more people. Yes.
Yes, Father.
Thank you so much,
Father.
Timmy, great. Thank you. Yes. And others, yeah. Hope everything is fine. See, Timmy, Gagan, all these people we remember so well, even what they sent, the materials, everything, because they have an attitude of like listening to, just following the instructions. Specialty I find is Northeast people. They are very docile and they listen to. I have noticed it. South is a bit difficult. We have seen so many institutes, we have seen so many teachers. Now everybody says this, but OET is not so good, so bad. Judgmental attitudes are there. So that is great. Anyhow, anything else? Yeah, and you have to read the notices, okay? And as soon as I post the notice, immediately you will ask link, Zoom link. Don't ask that because your notice clearly says enter the YouTube live and at the comment space, Zoom link will be posted. But you keep on asking Zoom link in the WhatsApp. Can I see all the messages? Instead of taking message session, I will be answering all those messages, hundreds of messages. So just read the notices when we send you. And not just noted father, that is not a answer at all, response at all. When I have typed 2 paragraphs full, your message is noted father. You should say what you noted. Okay? Or when I send, did you miss the session today? Please find the recordings here, link for the recordings here. Immediately at the bottom, please give me the Zoom link. I want to attend. Okay? So read the notice and respond. At least when I write 100 words, you have to write 5 words, right? You are the learners. Yeah, so that I understand you have understood the notice and you are following it. And also see that you go to the main platform and share at least one small knowledge what you gained today, some inspiration so that those who are really struggling, emotionally struggling will be strengthened by your words. Yeah. So let's make it a point. And also in the subgroups, make it a point and ask everybody, because those who are not attending, to send the links, video links, when you watch something new and helpful or somebody is asking for it, please post it there with a comment, okay? In the subgroups, batch groups, any video from our YouTube channel, not other videos. Don't bring in other videos because we don't know the authenticity of those features. So from the EduSkills YouTube channel, if some videos to be recommended, you can recommend at any of the groups. Okay. Yeah, Simi, and you are most welcome anytime. When you have free time, you can join any of the batches or all the batches. You are an elder now. Okay. Yeah. If you have some 5 minutes, anytime you can join and encourage them. I'll try to add you in the other batches, new batches. Only when you have time, you can come and just do them maybe 1 minute a day, 2 minutes a day. Just having a glance answering one person, they'll be happy. They'll be motivated.
Yes, Father.
God bless you all. That's great. God bless you. Thank you so much. Simi, praying for your way forward. Okay.
Thank you so much, Father.
We are stopping it for now.